Now I invite Dr. Manju M, glaucoma consultant at Arya Eye Care Thrissur, for delivering her talk on monitoring progression, visual field, and structural surveillance. Over to you.
Thank you, Dr. Maya, for this opportunity. Monitoring progression, visual field, and structural surveillance in normal tension glaucoma. So, what is progression in NTG? The progression in NTG is refers to identifying the worsening of structural or functional damage to the optic nerve over time, despite normal intraocular pressure. So, why is it important? It's important because progression can occur despite normal intraocular pressure, and there can be subtle structural changes that precede functional loss. And the therapy should be a treatment should be tailored based on the progression. The treatment modifications can be done based on progression, and there can be variable and asymmetric progression. There can be variation between the eyes and between patients, and all rate of progression can be varied. So it's important to monitor progression. So there are two things. One is structural progression, which is monitored as changes in the optic nerve head cupping, changes in the optic nerve head, like increase in cupping, thinning of the retinal nerve fiber layer, or and the ganglion cell complex, and there can be localized defects in the lamina cribrosa. And functional progression, which is measured by deepening of the existing scotoma, or enlargement of the existing scotoma, or appearance of a new scotoma. These are the factors that tells you about the functional progression. So structural progression, as you know, this monitor. Why is it important? Because structural changes in NTG especially can precede functional loss. There is quantitative measurements via OCT allow us to accurate tracking over time, and it's very essential in NTG and pre-perimetric glaucomas. And progression on OCT may prompt treatment modification in patients with unreliable visual field. That's one thing. If the patient is having an unreliable visual field, is important and can help you in the clinical decision making. So this is the OCT analysis usually done in glaucoma. And first, always check for the signal strength. Anything more than 6 is acceptable. Centers to the disc should be checked and see for any artifacts. And there is an RNFL thickness map. This is the absolute RNFL value of the patient, and it is compared with that of the normal patient to give a RNFL deviation map that compares the cluster of pixels with that of the normative database. And here is a quadrant map and a clock over map, which tells you the values of the patient in each quadrant and clock over. And there is also panomap, which combines RNFL values with that of the ganglion cell IPL complex. So it's important to monitor the macular factors of the changes in the macular factors like GCL, IPL thickness also with the progression. And this is a guided progression analysis, which tells you about the average RNFL thickness. You can get superior, inferior, nasal, and all. And each values, you should have two baseline values and current values also. It's better to have all reliable OCT values, and the system will tell you how the thickness is behaving over time, whether it is decreasing, whether disease is progressing, and all. So you can have a guided progression analysis. Next is the functional progression. Functional progression is measured by deepening of the scotoma, enlargement of an existing scotoma, and appearance of any new scotomas. So also there is also guided progression analysis system for functional progression. There should be minimum 5 fields, 2 reliable baseline fields around 6 months apart, and 3 follow-up field, total of a 5 field. And there's a trend analysis, which is based on the visual field index or mean deviation also, you can tell. So here the visual field index of each visit will be recorded, and the main thing is that system can extrapolate this data over next 5 years and tells you that if this patient is having the same rate of progression, what will be the patient's visual field index after 5 years. So there is a trend analysis, and it can tell you about the rate of progression also. So this patient, the patient was first visited in 2012, and 2 baseline fields are taken in 2012, and this is in 2018. And you can tell there is a steep decline in the patient's visual field index, and there is a rapid progression that is happening. And over 5 years, if the trend is like it's touching the baseline, means If the same rate of progression is happening in this patient, after 5 years the patient is going to get blind. So this progression or this system itself tells you that you should intervene. You should either increase the medication, do a surgery or laser to improve the or to reduce the progression of the patient. That is the importance of a gated progression analysis. And this also, there is one more thing: if the same rate of progression is happening and you are intervening something, you are doing some intervention, then you should change the, here the patient underwent a surgery, then the baseline field should be changed, so that the next two fields should be taken as a new baseline field, so you get a new rate of progression. If you keep the same previous baseline field, you will have the wrong rate of progression. So after any intervention, change your baseline field and see for the newer progression rate. And there is also an event based analysis which tell you any 5, whether there is a same point, same 3 points in same 3 consecutive visit, if there is a 5% deterioration. One is a open triangle, half filled triangle and a full filled triangle. If there is a less than 5% progression in 3 consecutive visit, and if there is a same point is having less than 5% deterioration in 2 consecutive visit, it is possible progression, and 3 consecutive visit, it is likely progression. And there should be 3 consecutive field, that is very important. And also if you see here, this compared to the baseline field, the latest field is improving, so there can be a learning effect also. So if you feel there is a learning effect, the newer after the learning effect, that field should be taken as a baseline field, so that you get a correct rate of progression. And here very advanced glaucoma 24-2 is almost touching the baseline, so in such cases the 10-2 field should be taken as a basic field for analyzing the rate of progression in advanced cases. And always this should be compared with that of the structural progression to get a correct, whether it is correct or not. So here this patient, there is a RNFL thinning, correspondingly there is a GCL thinning also, and this machine is telling you with this RNFL thinning where can be the field defect of the patient. So this is the area where the machine is telling you the field defect can be, and the HFA that is taken in the another machine, the patient is having field defect in the same regions. This means there is a structure function correlation. Always see whether there is a structure function correlation before taking the judgment. And here also there is a inferior thinning. The machine is telling you this is the area of probable visual field defect, and the patient is having the visual field defect in the same region. And there is NTG study that is all mentioned. So in that NTG study is the collaborative normal tension glaucoma study is the landmark study, and the risk factors that is predicting for faster progression was this hemorrhage, female gender, and a history of a migraine. So take-home messages are structural, especially in normal tension glaucoma, structural progression can precede functional loss. Central visual function is at high risk, so always possible incorporate 24-2 with 10-2 or 24-2C. Slow progression means it needs constant monitoring. It should have more structure function correlation also, and patient should have an individualized risk assessment. Thank you.